Hello, my name is Sabrina Diaz-Martinez, and I'm an assistant professor in the Department of Dietetics and Nutrition within the Robert Stempel College of Public Health and Social Work at FIU. I will be presenting the abstract metabolic dysfunction in Latinx with depression and anxiety. Based on a large-scale meta-analysis using global data by Correll et al., it was found that patients with severe mental illness show a 78% higher risk for developing cardiovascular disease and an 85% higher risk of death from cardiovascular disease compared to regionally matched general population. Thyroid hormone abnormalities are among the most common endocrine disorders comorbidly suffered alongside metabolic syndrome and type 2 diabetes. Subclinical thyroid dysfunction and euthyroidism, a condition in which the thyroid gland is working normally and producing normal levels of thyroid hormone, in those with cardiovascular disease or individuals with risk factors for cardiovascular disease, remains an understudied area in the literature and especially in underrepresented populations. Thyroid dysfunction within the euthyroid range may also impact mental health. The aim of this study was to examine the associations between cardiometabolic risk factors and thyroid function using thyroid stimulating hormone, TSH, among Latinx patients diagnosed with depression and/or anxiety receiving care at a community clinic. We conducted a needs assessment that involved a cross-sectional review of 100 randomly selected medical records from community dwelling patients that have been referred for mental health screening in the past year at Caridad Center. Caridad Center is the largest community health center in Florida to provide healthcare services. All of the data was de-identified to the principal investigators or to the investigators at FIU and Caridad. And the data included demographics, diagnosis, laboratory results, and the questionnaire protocol for responding to and addressing patient assets, risks, and experiences, which includes data on social determinants of health through various domains. Based on previous studies related to cardiovascular disease, the TSH cutoff point was high TSH, and it was 2 or more milliunits per liter, and low TSH at less than 2 milliunits per liter. Here on table 1, we're showing the characteristics of 100 abstracted patients, and out of the 100 patients, 93 were used for the analysis due to missing TSH data. There was a trend towards significance for greater chronic kidney disease presence in the high TSH group, and those with low TSH compared to high had a higher proportion of food insecurity and income that fell below the poverty level. I'd also like to point out that majority of the sample also had more than one comorbidity. Table 2 shows significantly higher mean values of fasting glucose, hemoglobin A1C, and total cholesterol in the low TSH group compared to the high TSH group. In a sub-analysis that included only type 2 diabetics with it showed that those with high median fasting glucose was found in the low TSH group compared to the high, and those with low TSH had 6 times greater odds of having high fasting glucose compared to those with high TSH. A greater percentage of individuals with high median hemoglobin A1C were found in the low TSH group compared to the high TSH group, and a greater odds of having high hemoglobin A1C was also found in the low TSH group. In a Latinx euthyroid patient sample with a diagnosis of depression and/or anxiety, we see that small differences in serum TSH may contribute to the variations in metabolic factors associated with cardiovascular disease. The literature also shows that variation within the normal range of TSH may increase the risk for greater depressive symptoms over time. We believe that this study may be the first to document these relationships. And as the population ages, the risk for multimorbidity increases, and therefore understanding how thyroid hormone dysfunction can influence chronic disease status may help to address health disparities suffered in disadvantaged and vulnerable populations. Therefore, these relationships warrant further study in order to inform public health policies and follow-up care for underserved and vulnerable populations. I would like to acknowledge the funding provided for this collaborative project that came from the FIU RCMI Community Research Enhancement Grant, and I'd also like to thank Caridad Center for their wonderful collaboration. Thank you.